Hello, this is Dr. Vosloo. Welcome to this tour of the clinic. Right now, we're going to go over the initial intake and evaluation process. The initial evaluation process is designed around our patient's needs and around the therapeutic steps that we need to implement after a thorough evaluation. So first of all, the initial contact with the clinic, it really requires you to reach out, contact us, so that we can understand how do we start evaluating to see if we are in fact the right center for you and if we have a good track record for what you have. The purpose of the initial evaluation, which is via telephone, is for us to get an idea of what it is that you are struggling with health-wise and if we are a suitable treatment facility for what you've got. You speak with both our patient services coordinator, and also there is time set aside for me to speak with you directly so that we can basically from our side assess to see if it's worth your time to come and visit with us, but also it gives you an opportunity to ask some questions, for us to put any concerns that you have on the table and to really make sure that as far as before we've even committed to each other with regards to treatment, that the informed consent process is followed so that you have more information in order to make good decisions based on your priorities. When you arrive at the clinic, we do a very thorough intake so that we can understand what it is that you're dealing with. We do an analysis of the different body systems and which symptoms manifest in them, as well as explaining to you in a detailed way which therapies we will start. At the same time, we start planning the laboratory diagnostic process, which typically on day 1 or 2, we do the blood draws for both local labs like LabCorp and Quest, but also specialty labs that can help us understand the cell biology of the chronic condition that you're dealing with. We use specialty labs with regards to chronic infections, especially the tick-borne infections, and whether we need to evaluate the genitourinary system, the digestive tract, respiratory tract, etc. We do work every day. As far as the initiation and intake process is a continuous process where we have sufficient time here, lots of time set aside, so that we can visit. In the true meaning of the word, the historical meaning, that we don't have the hurried visits in which there's no time to really get an understanding of the context of your situation. In this way, we do a thorough enough evaluation so that we can take the individual data points, the individual symptoms, and arrange them into patterns that actually have so much more meaning in the clinical context, especially where, you know, in my world, there's reasons for things, there's reasons for symptoms, and there's also reasons why symptoms and conditions don't clear up. In this thorough way, we do the due diligence process regarding arranging data points on the timeline in order to create patterns. And patterns create pictures, and that's much more meaningful. It comes to assigning clinical action items or treatments, therapeutic considerations towards eroding the foundational basis for why your condition persists, usually in the presence of having tried for many years across many different clinics and doctors without sufficient success to satisfy your life's timeline. In this process, with the gathering of data points, both through symptoms, evaluating your organ systems, through symptom questionnaires, and also through very, very thorough laboratory investigations to get, as far as we're able to, molecular confirmation of what we're suspecting. This adds up to literally hundreds of data points that we gather. So in terms of a multi-pronged analysis, we do an extraordinary good job at getting a foundational understanding of what's going on and how to arrange things in a way that is actually meaningful so that we can start getting traction clinically. So if you're interested in our intensive care cell stabilization protocol, please check out the information below.